Hello lovely people, and how are you doing? My name is Jackie and this channel is Thriving Womanhood. So in our today's video, we're going to discuss matters postpartum healing. Let's look at healing after CS. You all know that after the cesarean section, we have the incision that is done, that is 10 centimeters, and then they cut several layers, and finally they snatch the baby. That wound has got some layers, as you can see here on this video is explaining so well over here. As you can see, there's a lot of layers to heal. So how do we enhance the healing process after cesarean section as mothers, that is during postpartum? The first thing is early ambulation. Begin walking as soon as possible. It will enhance your breathing. It will also help in faster healing and prevent the blood clots from lodging in your arteries and also in your lungs. So walk as early as possible. The next point is wound care. So the incision area, that is the area that you've been cut, should be kept dry and clean. You should take care of it as instructed by your healthcare provider, because different women have their bodies respond differently and their healing processes are different. So take care of that wound according to the instructions that you've been given by your healthcare provider, your gynae, or even your hospital. Ensure that it is dry. Ensure that if you've been given the methylated spirit or the iodine solution to apply following the instructions that has been given, because if not, you'll have the risk of infection, and if you're infected, you might go back to the theater, and we don't want that. Or you might be needed to go to the hospital daily for dressing of that wound. If your healthcare provider asks you not to take a shower for the next 2 weeks and just be wiping your body for the sake of the healing of that wound, please follow the instructions that have been given. It's for a week or 2 and you will be cleared. After being cleared, use gentle soap that is not highly scented. Ensure that it is clean and pat it to dry rather than wiping. So you pat it to dry, pat that area to dry, because it is still sensitive. The muscles around are healing and recovering from the stress of being cut. So be gentle, tap it to dry as opposed to rubbing. And when applying the methylated spirit, apply once, just like this, or the iodine solution, just apply like this. Don't apply. Do not wear innerwears that are touching. If you're going to wear the innerwears like the panties, wear the high waist ones. All, if you don't have them, stay without them, so that will fasten your healing process. The next way you can take care of yourself for C-section healing is taking adequate rest. Avoid lifting heavy stuff and strenuous activities for the first 6 weeks or until you're cleared by your doctor. This is not the time to go to the market. This is not the time to run up and down with the house chores, but it is the time to take advantage of those giving you support, like your husband, your partner, and also your friends and family members, so that you can take rest. Whenever your baby is sleeping, take a nap. Or if there's someone who can hold the baby for you, babysit them and take care of the other babies, so that you can take rest, make use of that opportunity. Sleep adequately, take enough rest, and also ensure that you're not lifting heavy stuff, because when you're lifting heavy stuff, it may make your wound to strain and also leading to delayed healing process. Pain management, and of course one of the ways is by taking the medications as directed and as prescribed by your healthcare provider, and this will help in pain relief because of the painkillers, and also there are antibiotics that will help in prevention of infection in the incision area. Take your medications as directed. Do not skip. Do not say, oh, I'm okay. Take the full dose. Look out for the signs of infection in the incision area. Look out for swelling or any redness or any discharge from the area of incision. In case you see any of those signs, please go to the hospital for the check-up and also for advice. Check the area of incision frequently, and if you're not able to, because of course the pain and you're not able to bend, you cannot lift the baby pooch in order to see, please request the person who is taking care of you to check it, let's say daily, or your partner to check it daily, so that you can monitor the progress of that incision area. The next thing is the scar massage. Okay, after healing the incision area, you're left with the scar, and this scar, you can use oil such as coconut oil to massage it so as to increase flexibility in that area. Massage the scar so well so that you'll have flexibility in that area. Next thing is nutrition. After CX delivery and after any delivery, this is not time for junk foods. This is not time for carbonated drinks from the fridge or cold drinks from the fridge. This is the time to mind your nutrition. So eat food that is rich in nutrients, and this food will help you in muscle repair, in the tissue repair. It will fasten your healing process. It will boost your blood level and also boost your energy levels, and also give you enough milk for your baby. So ensure that you're eating a well balanced diet, including the fruits, the leafy vegetables, all grains, and a lot of fruits like porridge, soup, herbal teas, so that they'll help in flushing out the toxins from your body. The other point is self-care. So it's important to take care of yourself. You're the one who knows how you feel, for example, in laughing or even coughing. So ensure that you put a pillow on your abdomen when laughing and support it. And also when you're coughing, support it with a pillow. Again, avoid bending so as to avoid straining the muscles around your abdomen. The next point is follow-up. Your healthcare provider will schedule follow-ups, for example, after 2 weeks, so as to ensure that any complications are addressed early. Attending all your postpartum appointments will help monitor healing and discuss any concerns. If you're going to attend all your postpartum appointments, you will be able to discuss any points of concern and also monitor your healing process. For example, if you're scheduled to visit your healthcare provider after 2 weeks, please do that without fail, so as to monitor your healing progress and also to see if there is any point of concern. So that is the cesarean healing. So the next thing we are going to look at is the vaginal healing.